For anyone on the phone line, Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Thursday, July the 16th. Honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. Tomorrow, Friday, we'll be providing a written briefing around 3 o'clock. The next in-person briefing will be next Monday, which I think is July the 20th, I'm guessing. July the 20th at 3 o'clock here. At that time, Dr. Henry will be presenting some of the results of the survey that we did of more than 350,000 British Columbians with respect to the impact, the health and other impacts of COVID-19 on their lives. And with that, I'd like to proud to introduce Dr. Bonnie Henry.
Thank you and good afternoon. For today, we have 21 new cases of COVID-19 in BC. That includes 18 people who tested positive and 3 epidemiologically linked cases. That brings our total of people with COVID-19 to 3,170 in British Columbia, including 1,028 people in the Vancouver Coastal Health Region, 1,667 in the Fraser Health Region, 136 people on Vancouver Island Health Region, 223 people in the Interior Health Region, 65 people in Northern Health, and 51 people who live outside of Canada. We have no new healthcare related outbreaks, but 3 active ones that are ongoing, 2 in long-term care and 1 in acute care. We are now up to 655 people in long-term care, assisted living or acute care who've had COVID-19, including 400 residents and 255 staff. We have no new active community outbreaks other than the ones that we've reported on this week. We now have 4 cases related to the Crazy Cherry Farm. And we have continuing with contact tracing and trying to determine the number of people related to the community exposures events in Kelowna. There are 27 cases now associated with those exposure events, 18 of whom live in the Interior Health Region and 9 people in Vancouver Coastal Fraser Health Regions. I do want to remind people that if you have been at one of the locations within a community exposure event, you do need to monitor carefully for symptoms, limit your contact with others through this incubation period, and contact 811 if you have any symptoms at all to arrange testing for COVID-19. We have 192 active cases right now, of whom 15 people are in hospital and 3 now in critical care or ICU. We have no new deaths to report in the last day. Our total remains at 189 people who've died from COVID-19, and 2,789 people have now fully recovered. Earlier this morning, we presented some information around one of the research projects that we have been talking about on and off over the last number of months, and that's our Sero survey that was done here in British Columbia. Every day we have learned more and more about the virus, about our ability to protect ourselves, and about disheartening social effects that this pandemic has had. This Sero survey helps us understand the impacts that the COVID virus has had on people in British Columbia. And this is a project that we funded through the Michael Smith Foundation for Health Research early on. Researchers at the BC Centre for Disease Control, particularly Dr. Danuta Skowronski, Dr. Mel Krasden, who leads our lab there, and a team at both BC CDC and UBC. As well, Life Labs has been involved in this project. This was the first report of its kind released here in Canada and gives us a sense of the impact that this virus has had in our community. The important part of the report shows that we have been very effective of flattening our curve here in British Columbia. Less than 1% of people a test that helps us understand how many people might have been infected in the past. And the way that this protocol was run, we received 1,000 samples from a community laboratories across the Lower Mainland, which was the area where we know we've had the most cases of COVID-19. So this is the highest risk area in the province, and those were tested at 2 different time periods to give us a sense of the progression or snapshot of the progression of the virus in our community. It is people who live in the community, so it doesn't take into account people who are in long-term care homes, but we have it across 10 age group bands across the age span in our community. What this does tell us is that there was very little circulating virus in March, which is what we would expect. And then later on, after our peak in May, when we did a second snapshot, we had less than 1% of people who had antibodies in that snapshot. What this also tells us is that we have done a good job of preventing community transmission in British Columbia. And outside of the Lower Mainland, we would expect these numbers to be even less. We also are able to estimate how many people might have had infection that didn't have a test, particularly during that period in March where we had limited access to tests and where our testing strategy really focused on those who were at highest risk of this virus. As you will recall, there were hundreds of people and thousands of people who were coming back to British Columbia in March from many places around the world, and they brought their risk with them from those places, and many of those people did have milder forms of COVID-19. So our estimations are that about 8 times more people than tested positive in this serosurvey likely had the virus in British Columbia, which gives us around 16,000, 17,000 people who may have been infected over the period of the last 6 months. This is in keeping with very similar studies that have been done in other places around the world. So this tells us that we still have very low levels of this virus. And we don't yet know whether having these antibodies means that you're protected, that you're immune from this virus if you get exposed to it again. Those are other studies that we are participating in and leading both here in Canada and internationally to help us better understand. But it does help us know how many people might have antibodies at this point. So we're learning a lot. There's much, much more for us to continue to understand. And the thing that we need to remember is that most of us do not have antibodies to this virus. We have not been infected, and we need to keep doing the things that we're doing to minimize the effects of this virus in our communities. I also want to just mention that the media have done a fantastic job, I believe, of helping us ensure British Columbians, people in BC, have the best information that they need to understand how to best protect ourselves, our families, and our communities from COVID-19. If you have questions about COVID-19 and are looking for guidance, go to the BC CDC website. There is a lot of information there, and it is your first point of contact, your source of truth for the information that we have around what you can do here in BC. The latest information is available, and all of our numbers, the dashboard that's available on that website every day. For non-medical information, 7 days a week, you can call 1-888-COVID-19. And of course, for health questions, there's always 811. So as we know, we have been able to flatten our curve and restart much of our economy, see our friends again, and we're now in that balancing of opening up our society, opening up our economy. But not everybody is weathering this storm well. Today, the BC Coroner Service released their illicit drug report for June. And as was the case in the previous month, we have had a tragic record number of people who have died from the toxic drug supply that we are facing here in British Columbia. 175 of our brothers and sisters, our family, our friends, our community members died in the month of June. This is a tragedy for all of us, especially for the families and the friends and the communities of these people. And this ongoing crisis reminds us that we need to put as much time and effort and kindness and compassion into caring for people who use drugs as we do, as we have been successful in doing in responding to the COVID-19 crises. As we know, these are mostly young men. About 80% of people who died were men between the ages of 19 and 49. 2/3 of people died in their own home. And we know from the conversations we've had with family, with friends, that most of their family and friends did not know that they were using drugs, and many of them died alone. We need to reach out to our family and friends. We know that the pandemic has meant that we have less access to some of the important things that were making a difference in saving lives from the toxic drug supply that we've had. We know that overdose prevention sites have been less accessible, that those supports that people have had in the community have been less accessible, and those things that we have had to help keep us safe have not always been there. We need people to reach out. Reach out to your family, reach out to your friends, reach out to your colleagues, the people you work with. Make sure they know it's okay to talk about this with you. If you need help knowing how to have those hard conversations, you can go to things like Stop Overdose BC. There's information there that we can share with each other about how to have those conversations to support people who know that right now are at great risk. So get the training you need. We also need to make sure that we are supporting our communities by getting access to pharmaceutical alternatives to the toxic street drug supply. The coroner's report shows us once again that the toxicity of the drugs on our streets right now is through the roof. We are seeing very high levels of fentanyl and carfentanil and other contaminants, not only in the opioids on our street, but also in stimulants, in methamphetamine, and other drugs. Nobody is safe right now. We need people, we need clinicians to take the training we need to support people who use drugs to access pharmaceutical alternatives. We need to think about the evidence-based system of care. We need to be able to connect with people and bring them in to those services that are still available for them. We know that safer supply, hydromorphone, diacetylmorphine, is not what is killing people in our streets right now and in their homes right now. It is the toxic street drug supply. I also know that there's many complexities to what has gone into the overdose crises, and we were doing okay addressing many of those. One of them, which I will still call for, and which recently the Chiefs of Police of Canada have called for as well, is reducing the stigma for people who are at home who are using drugs. And that is by decriminalizing people who use drugs, who have possession small amounts for their own use. And I am calling again on the federal government to take this to heart, to take the advice of the chiefs of police who know that this is an important step that we can move forward on together, and there's no more important time for us to do that than now, when we are seeing this not only here in BC but across the country. We have also put out how we can do that here in BC, and I am continuing to push for that as well. Finally, I think it's very important for us to be kind to people who use drugs, to escape the pain that they live with, and to make sure that we are doing everything that we can to connect, because we know that connection is what helps people get on their own personal journey of recovery. For those who are using drugs right now, don't use alone. Buddy up. Use the app. Have naloxone available. Call 911 if you're with somebody who's overdosing. Have your drugs checked. This is a very dangerous time for people who use drugs, and we need to be here to support you. There are still harm reduction services available. We know that we can support you. but you need to reach out as well. And we need to not assume that our friends are okay. We need to reach out and have those conversations. So as we have for the COVID crises, and now more than ever, we need to show kindness and compassion to our neighbors, our friends, and our loved ones. These challenges we are facing are not forever, but they are going to last for some time. So we need to help each other out. We need to care and support each other through this pandemic and through both our crises. And we need to continue to do what we have been doing, to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. And I want to start by saying that today, and in the COVID-19 pandemic, we report no deaths across British Columbia. And in terms of the COVID-19 pandemic, that's a very positive thing, although 189 people have passed away from COVID-19, and we know its impacts on our population in so many different ways. And we have to acknowledge on a day when we had 21 more cases, and we have 15 more people in the hospital with COVID-19, that the fact that we're thinking about today most, and I'm going to be reporting later on lots of facts, is the 175 people who lost their lives in the overdoses in the month of June. That's 4 more than the 171 who lost their lives in May. And I know that my colleague, the Minister for Mental Health and Addictions, Judy Darcy, has made a statement and has spoken about this question, but we know and we reach out to all of the families involved, all of the friends involved, the communities involved. We know that the overdose crisis affects people in every corner of BC, in every community in BC, from Cowichan to Vancouver, from Prince George to Burns Lake to Fort St. John to Cranbrook. We know it affects everyone. These are our community neighbors, they're our friends, they're our family members, and we mourn their loss, and we have to commit to doing more to address our other public health emergency, because this is a COVID-19 briefing, but one of 2 public health emergencies that our province are facing right now. I note that the actions that have been taken are significant, that they saw a reduction in 38% in overdose deaths prior to the COVID-19 pandemic. We've also seen significant action, new treatment beds, the Lifeguard app, increased safe consumption sites, as I say, a significant increase in opioid agonist therapy in both those who are able and prepared to prescribe it in the province and those who are using it, more than 23,000 this past year. We know that the changes that we made in March to support dispensed hydromorphone have seen an increase of 190%. That's from 677 people in March to 1,962 people in May who have used that service and that alternative. And we encourage people to reach out to their loved ones who may or may not be dealing with this toxic drug supply, and we encourage people who face issues around addiction to reach out as much as possible, to not use alone, as Dr. Henry has said. But we encourage them to reach out and to call 811 or to consult with their doctor or to consult an urgent and primary care center if they want to pursue prescribed alternatives, because prescribed alternatives in this time make sense for everybody. And I want to encourage everyone to do that. And still, all of the actions taken, and Minister Darcy would provide a list a lot longer than that, and still 175 people passed away in June, and we mourn them. I wanted to report on some of our progress, as I do every Thursday, with respect to our surgery renewal update. We know that on March 16th, we postponed all non-urgent scheduled surgeries in BC. From March 16th to May 17th, we completed 23,536 urgent scheduled surgeries and emergency surgeries. On May 18th, We resumed non-urgent scheduled surgeries, delivering them, as well as continuing to perform urgent and emergency surgeries. 47,232 surgeries were completed since surgeries restarted on May 18th. Of those 47,232 surgeries, 36,173 were scheduled surgeries and 11,059 were unscheduled or emergency surgeries. By health authorities, that's 8,752 in Interior Health, 13,407 in Fraser Health, 10,698 in Vancouver Coastal Health, 9,885 in Vancouver Island Health, 2,566 in Northern Health, and 1,924 in the Provincial Health Services Authority. Last week, which was the week that involved Canada Day, we performed 5,370 surgeries. As you know, we had reported 5,259 completions last week, but the health authorities have restated the previous week's volumes, which led to an additional 111 completions being reported between June 29th and July 5th. Last year, in the same period, 5,300 completions were done during the week that included July 1st, so 70 more were done in the context of this pandemic than had been done in the same week the previous year in 2019. This week, we are reporting 6,322 surgeries were completed. This is 952 surgeries higher than last week, but last week, you'll remember, included Canada Day. As of this week, we've now contacted 62,744 patients to discuss rescheduling their surgeries. That's an increase of 3,298 from July 5th. You will note that approximately 1,500 of those patients have, for the moment, declined for what we describe as a COVID-19 related reason, which is a relatively small percentage of the number of the people we've contacted. And we have taken 4,374 people off the waiting list as we are in the process, of course, through these contacts of cleaning up that list. I want to also provide you with an update on visits to long-term care. As you know, on June 30th, we announced the easing of restrictions for visitors at long-term care facilities and seniors assisted living facilities in BC. We recognize the hardship of being apart from our loved ones for the many long weeks from March when visits were restricted to this point. The extraordinary importance of visits in long-term care is understood by everybody, what they mean for residents, what they mean for families, what they mean for the facilities themselves and those that work there. It's not just about extending life, it's about living life. Each health authority has been working actively on their plans to safely allow visitors at long-term care and assisted living facilities in their health authorities. I'm pleased to report that this week there are currently 318 facilities with safety plans in place. That's an increase of 257 from last week's 61. This is as of yesterday morning, and the number, as I understand it, has increased very significantly since then. I will report next week on our ongoing progress. Our ongoing social, surgical, and economic renewal depends on each of us following the rules and using the skills that Dr. Henry and our public health officials across BC have taught us. No matter where our BC renewal finds us, whether back at work, getting ready for surgery, visiting with a loved one in a long-term care home, traveling BC, or reconnecting with friends and families, it's our disciplined and dedicated practice of these skills that has brought us to this point, and it's helped us to stop the spread. To avoid a resurgence, we must continue to use the skills we've been taught. To make our social and economic renewal last, each of us must act to prevent a resurgence. To make sure patients get the surgeries they need, each of us must act to stop the spread. To make sure that we're able to visit our family and our friends in long-term care, each of us has responsibility every day to stop the spread. As we meet and reconnect with friends and take the precautions we know we must take, let's continue to use the skills we've been taught in our BC pandemic. Physical distance saves lives. Safe social interaction stops the spread. And being outside has a big upside. This weekend and in the weeks and months ahead, our future remains ours to shape. Merci beaucoup. Je vais dire quelques mots en français. Aujourd'hui, nous annonçons 21 nouveaux cas qui ont testé positifs pour COVID-19 en Colombie-Britannique pour un total de 3 170 cas dans la province. Il n'y a eu aucun nouveau décès et je m'en réjouis lié au COVID-19 pour un total de 189 décès en Colombie-Britannique. Nous continuerons à offrir nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 15 personnes sont actuellement hospitalisées, dont 3 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. À ce jour, 2789 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question and one follow-up only. Please take your phones off mute. You will not be audible until I call your name. First question is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. I wonder if I might ask you to go back over something you said this morning so I can fully understand it. And that is, you were talking about the many calls you've had for expanded testing, of just routine testing. And you said that in light of what we learned, as I understand it, you said in light of what we learned from this first serology testing, that to just do more testing, more expanded testing, would be a waste of resources. It really wouldn't help us understand anything. Am I understanding what you said, or could you clarify, please?
Sure, and yes, we're talking about serology testing, so different from testing for people who might have the disease now, where we do what we call NAT testing, or the nasal pharyngeal test that looks for the virus. So the serology test, which looks for antibodies, and it gives us a sense of how many people have been infected in the past, because it takes 4 to 6 weeks to develop these antibodies. So it's not any good at telling us who's sick now with the disease. So in that context, yes, we have been waiting on some of the information from studies like this one that we did, this Sero survey, to help us understand how much disease there has been in the community over the past since January, really. So what it tells us is that it's not going to be helpful for us to randomly do more serology testing just of anybody. What we need to do is have a better understanding of how we can target serology testing to understand who has been most impacted by this virus over the last few months. So what we are going to do is looking at our survey that we did, the Your Story, Our Future survey, and I'll talk more about some of the details from that on Monday. One of the questions we asked in that survey is, would you be willing to be part of a serology study? So we will be looking at how to best understand the impacts. So this is when we can target serology testing at different occupations, people who are healthcare workers, people who have been working during the shutdowns that we had over the last few months, to see if it's higher in those populations than it is in what we've done, which is looking at the general population. We'll also be looking at whether we should be oversampling people from different racial groups or ethnic groups or socioeconomic groups or different geographic groups. And the survey is going to help us understand that. So the next step of that survey will be some targeted serology testing to help us better understand who's been most impacted by the virus.
Do you have a follow-up, Vaughn?
Yes, please. The other thing that I wanted to try again, just to make sure I understand it, was there's been talk all the way through about possibility of British Columbia reaching, or a society reaching, a threshold of community immunity. I believe you said this morning that these numbers, this survey is enough to tell us that we're still a long way from that we are not going to be able to depend on that to see us through the pandemic. Is that also a correct reading of what we've seen from this data?
Yes, absolutely. So at 1% of the population at most being infected, and recognize that this was done in the Lower Mainland where we had most community transmission. So it's probably even slightly less in other parts of the province, but some communities have been more affected than others. So what this tells us is there's still a lot of us, most of us out there, who are not immune to this virus. So community immunity is probably, from the modeling studies and what we've been seeing around the world, you probably need to have at least 60% of the population to have immunity before that's going to protect us all. So we are long ways from there. But let me put that in context, because even in places where they had rapid, lots of community transmission, rapid growth, like New York City, like Spain, for example, where they have done similar sero surveys, so serology studies of random samples in the community. In Spain, they just released a report, and it was around 5%. So even though they had that tremendous wave, and they had a lot of transmission and a lot of illness, and tragically a lot of people who died, it's only a very small proportion of the overall community who was sick from the virus. So, and we have similar information from the U.S. The U.S. Centers for Disease Control did a similar study where, with using similar methodology to ours, so different studies use different things, but ours, a similar one to ours, showed that the range in the U.S. was about 1% of the population, similar to us, in some states, up to about 7% in New York. So nobody in the world has reached that point of herd immunity. What we need to get us to that level is an effective vaccine.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Just again, we touched on this a bit earlier in the week, but your thoughts now on airlines like Air Canada asking for the 2-week quarantine to be reduced for anyone arriving in Canada from other countries at a time when just yesterday we saw 4 more flights have had people with the virus on them.
Yeah, so I absolutely do not think we should be reducing our quarantine. We need to be very cautious. And many other countries in the world are doing the same thing. If we fly to the UK, we are expected to quarantine for 2 weeks. I do think there are places that we could look at, and particularly here in BC, where we know our transmission is low, although it is, still grumbling along, as we know. So, places like New Zealand, places like parts of Europe. Having said that, they are also being very cautious. So I do not see that quarantine period being reduced or stopped in the near future. And we only have to look around us to see the risks that can bring. I do think, I can't wait to go traveling again. I love travel, and I am missing it more than anything. But I do think we need to be rational and reasonable and find ways to do it that are safe. And we have people who have traveled even just within Canada where we do not have a quarantine period who have turned up ill. And so the things that we need to have in place are being able to find people quickly. And this goes even when, and I say when very intentionally, when we reach the point where we no longer have to quarantine people. It may not be for a while from some countries, but even then, we need to have a way of contacting people quickly. We've talked about this quite a bit. We have that balance between trying to minimize the spread and doing the contact tracing that we do in public health to find every single person and break those chains of transmission. It's when transmission gets going between groups of people who don't realize it, and they're with larger groups, and those people spread out. That's when we start to see broad community transmission. So one of the challenges we have had forever is getting flight manifests that are usable for us on a day-to-day basis, on a rapid basis here in BC. So when a flight comes in, whatever airline it is, because this is a common problem, we can get access to, we may not identify somebody as being sick until a couple of days later. We get their name, we know where they were, but we get a flight manifest that has a lot of information that is not particularly helpful. So right now it has things like, depending on who booked your ticket, whether it was booked online, it may have a name. It always has a name, but it may be the name of the travel agent or the person who booked your flight, depending on the system that's being used. So what we have been doing across the board here in BC anyway, and other places, is requiring restaurants to keep a contact information, requiring nightclubs to have information so we can contact people if there was an exposure event. So that's what I would like to see. I think it's a very rational ask of our airlines that when somebody checks in, they need to provide a name, a phone number, and an address. An address is really important because that helps us understand where we have to look for those people. And if we can get that, that facilitates us being able to find people quickly and stop those chains of transmission. And that, in turn, makes air travel safer.
Do you have a follow-up, Marcella?
I did, and it's sort of along the lines of questions I've asked before regarding the ongoing call for people who want to have drive-in concerts. And we've seen in Alberta now, there has been Brett Kissel, who's a country music artist, that's had 60-minute concerts where he has essentially told people, you drive in, you can't go to the bathroom, you just sit there for 60 minutes, listen to the radio, listen to the concert, and you drive out. And the people that I've been talking to say they need this to be accessible for at least 200 vehicles in order for them to be able to make a profit from it or to keep people employed. Is that something that you're now considering, even though I know you said the 50-person limit is still standing? That doesn't seem to be the case for places like Playland and other places where more than 50 people are allowed.
Yeah, I think we're talking two different things. So Playland, you can have a small number of people. They're not all together for an event with people that you don't know. It can be managed like a grocery store can. So no, you know what? One of the things that I look at this across the globe, where events happen, what are the conditions, how do things move, and we've had a literature review just recently on this, and we are going to be consistent here in BC. We're sticking with 50. We need to adapt to that. It's a balance between numbers of people that we can find quickly and reducing risk and trying to find ways that people can be innovative and keep things going. And there are many of those out there. You know, there are many businesses, there are many other events that have been able to work within that limit. And where they have not worked within that limit and we've had transmission, it's caused great angst. I mean, we have had more than that in certain events that now we're trying to track people, and there's been cases spread across the province and come in from other places. So yes, it's a challenge when people are doing things differently in different jurisdictions, but we are going to be consistent. We're sticking with the numbers that we have here. And really, to be honest, I know this is hard for some businesses, and the last thing I want is for businesses to go under. But this is where government needs to support business as well. And we need to look at how we can find that hybrid to support safety as we move through this pandemic. It is not going to be forever, but it is definitely going to be for this summer and into the fall. And, you know, sick people don't go to concerts and don't go to movies, and we don't want to be going back to that.
Next question is from Ahmad Agahi, CTV.
Thank you so much. Yeah, we're hearing more and more from transit riders in Metro Vancouver who want it to be mandatory to wear masks on public transit because, of course, it is hard to physically distance sometimes on a crowded bus or SkyTrain. TransLink says that it would look to you for guidance on that. I just want to ask you what your current stance is. I know changes day to day, from what we hear around, other jurisdictions and when someone bans it and someone doesn't. What's BC's current stance and from you? And also, is the inability to enforce such a thing maybe what makes it difficult as well?
Yeah, enforcement is a challenge, and we've seen some unfortunate events that have been related to people making it an issue. I absolutely think everybody on transit should be wearing a mask, everybody who can. And the challenge then becomes who determines whether somebody can or can't. And I've been seeing some reports about people having fake cards, and we just do not want to go there. If you are taking transit right now, you should be wearing a face covering unless there's a very valid reason why you can't. We know that sometimes it's hard to tell when people cannot wear a mask, and it may be around physical disability, not being able to put one on or take one off, for example. There are very few medical reasons why people can't wear masks, and we do know, and I just want to put this out there as well, since you've given me the opportunity. Masks are safe to wear. They do not cause you to become hypoxic. They do not increase your risk of keeping viruses or bacteria or other things in. They do not exacerbate asthma or other lung conditions. You need to find one that's comfortable, that you can take on or off as needed, and sometimes it takes some time to get used to wearing them, and I know that from my own experience, but also my mother was telling me this recently too, that she and my father are very good now about wearing their mask outside all the time. Well, not outside necessarily, but in the grocery store or the drugstore when they need to go out. So yes, we should be using masks on transit all the time. I do, and I expect others to as well.
Do you have a follow-up, Ahmad?
No, thank you very much.
Great, thank you. Next question is from Ethan Sawyer, CBC.
Hey, Dr. Henry. You have been very clear about your position when it comes to supporting and not shaming people who use drugs. At the same time, though, stigma around drug use being a choice, even initially, still kind of exists. In fact, the Premier made a comment to that effect earlier today. Do you feel as though comments like this fuel that sort of stigma?
You know what? I'm not aware of what the comment is, but I will tell you that we know that there are many reasons why people use drugs, and there are many reasons why people continue to use drugs. And in the words of Grand Chief Doug Kelly, and he talked about particularly First Nations people who use drugs, and he said it's not a drug problem, it's a pain problem. And I absolutely agree with him. Whether it's physical pain, whether it's emotional pain, whether it's psychosocial pain, the pain of the family trauma that you've gone through, those are things that lead people to use drugs. Nobody grows up thinking, I want to be addicted to substances. I want to have a substance use disorder. I want to have this controlling my life. There are many reasons why we get into that. We know, particularly for opioids, that they change our brain in ways that many of us are fine with. But some people, there's that combination of their own emotional, physical state and their genetics and the way their brain reacts to substances that make it much more likely that they are going to develop an addiction. So there are many, many reasons why people use drugs, and we cannot be judgmental, particularly now where it is such a dangerous situation, and that we know we have things that can support people. And we can support them in using opioid substitution therapy. We can support people in having a safer supply so they're not reliant on the toxic drug supply that we have on the streets right now.
Do you have a follow-up, Ethan?
Yeah, I'm just wondering, given kind of your non-judgmental approach, will you be following up with the Premier about his statement on drug use as a choice?
I have regular conversations with the Premier, and I'm sure if that's the way it came out, that was probably not his intent.
Just to say, Ethan, the Premier has been an advocate. You heard him last week. His support for the recommendation from the Canadian Association of Chiefs of Police, the fact that since March we've taken unprecedented action in terms of prescription alternatives for people facing addiction issues, led by the Premier, added addiction beds. We are treating this as a public health emergency because it is, and no one believes that more strongly than Premier Horgan.
We have time for one more question.
Absolutely. I have never had a conversation with the Premier where he has been anything but respectful of people who use drugs.
We have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released shortly. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Nick Johansson, Castanet.
Hi, Dr. Henry. In regards to this cluster in Kelowna here, do you have any sense of a week on here, having a sense of how widespread this transmission has been in Kelowna itself? Does this cluster give you any pause about encouraging tourism from other parts of both BC and Canada as a whole?
Yeah, so, Interior Health has been very actively following all the trails, and we now, as we've said, had 27 cases, 18 of whom are people in Kelowna. I believe we're confident that we're finding people and isolating them before they develop symptoms themselves. So that's the way we break those chains of transmission. So I know they're doing a great job up there. It is a lot of work, but it is our day-to-day work in public health, and it is being effective.
Do you have a follow-up, Nick?
Just going back to my question about encouraging tourism, is this giving any pause about encouraging tourism from across BC and the rest of Canada?
We have to find that balance. And what we need to do, and what we've talked about a lot here, is we know the things that protect our communities and allow tourism and allow us to get together with our friends and our families. And that's keeping numbers small, keeping our physical distancing, wearing a mask in those enclosed situations, making sure we don't have large numbers in crowded places, talking closely to people, because those are the risky environments. So we need to ensure that we have those measures in place and that we can have safe meetings and gatherings and get-togethers and parties with small numbers of people this summer.
That's all the time we have. Thank you.
Thank you.